Dr. Al-Daghma, thank you for speaking to us.
You're welcome, anytime.
Has the pause in fighting improved the situation at the hospital?
Well, indeed, not exactly, because we were supposed to receive medical aid, medical supplies, and we haven't seen any yet. And working conditions are still bad for us, because our staff were really suffering in all sorts of ways. And we still lack a lot of medications, medicines, as I told you, painkillers, medical supplies, so many stuff. We haven't seen anything reaching yet. We don't know why.
So can you describe the circumstances in the hospital? Because I know it was very crowded before. What's it like now?
It's a bit less crowded, but we still suffer in all sorts of ways in providing. You know, our hospital is now a shelter for many people. Many patients who were treated and went into surgeries and they were discharged. They refused to leave the hospital along with their families because they have nowhere to go. So our problem now is to provide beds for the new patients, and we don't have any. So we don't have any vacant beds for the new patients to come, and we are afraid of that war restart again after today. Today is the last day of the ceasefire, and we don't know what was going on.
We understood that there were supposed to be more supplies. It was part of the deal to release the hostages. Do you know why you haven't had more medical supplies reach the hospital?
I don't exactly know why we didn't receive yet any of these medical supplies. As you know, we have here a paediatric ICU. It's full of multiple casualties patients that we are not used to. This is a medical pediatric ICU. But we were obliged to deal with these traumatized and injured patients. And it's a multidisciplinary management now, especially the cases with extreme burns. Maybe I'll show you later. The specialists in burn medicine, they need specific medications and expensive medications, and they don't have it, so we deal with what we have. And we didn't even get basic things, basic medications, like painkillers, especially for the burnt patients. They need extensive pain management.
Let me ask you about that, because burns patients particularly need very strong painkillers. Are you saying you have burn victims and not enough painkillers?
Yes, exactly. And unfortunate for them, they have extensive burns, and we lost many patients due to lack of medications and due to the extreme nature of the burns that they have. Like we have here behind me, one patient with 70% surface area, deep and third, fourth degree burns, and really the prospects and the survival rate in these cases are nearly nil, especially if we don't have the proper medications and the proper disciplinary management.
And doctor, during the very difficult time you've lived through over the past weeks, when I think the hospital was extremely crowded at times, did that mean you had to make decisions about who you could and couldn't treat?
Yes, this is a very sad and difficult situation for us, and very bad and difficult situation and decision to make. We were faced with this dilemma many times, of course. Then we were like overcrowded with patients, and sometimes we had to let patients go, and we choose not to resuscitate them because we were having a dilemma of decision that we may save other patients. Other patients may have better survival rate and better chances to survive. But we were faced with these scenarios many times, yes, and along the 50 days of war.
And what kind of impact is that having on you and your fellow doctors? having to make decisions like that?
It's sad, I told you, it's a very sad and difficult situation, but you know, we emotionally, maybe in the beginning, we were like getting and hearing a lot of sad stories from the family members. We had patients who lost all of their families, and we try not to get so emotional and try to work professionally. Of course, every physician and nurse has their emotional part, but we try to indulge in our job professionally and make the best decision for everyone. It's heartbreaking, it's difficult, of course, and painful, but we try to get focused on the right medical choice and right medical decision to make.
I just want to ask a question about yourself, Doctor. You have an Egyptian passport. You could have left when the war started. Why did you stay in Gaza?
It's unquestionable issue, really, for me. I couldn't leave my... I am supervising pediatric ICU as well as pediatric departments. I'm head of pediatric department. It is not a question for any physician to leave his place during a war. This is like a soldier leaving his army during a war. We cannot it was not even considered an option for me. All our staff now are suffering from all these different views. We don't have cars we don't have fuel for our cars. There are no cars on the way. Some doctors come walking from a long distance. Some use carts with animals, horses and donkeys. So it is extremely difficult to get physicians into the hospital. We are short of staff here. And even our colleague doctors are suffering on the personal levels. They don't have anything to provide for their families. Since 2 months now, nobody took his salary. And even who has money, there is nothing to buy. And we don't have enough water. We don't have foods. We don't have any electricity. So it's extremely difficult to the staff. Even in the hospital, we don't have enough food for the staff. Some doctors work for more than 24 hours and rest for a few hours. So it's extremely difficult for medical staff. We are exhausted after 50 days of continuous work. Sometimes we sleep just a few hours and get back to the job. So the working conditions are extremely difficult. And it's really becoming worse by the day, by the hour.
Dr. Al-Daghma, thank you very much indeed.
Thank you very much.
Thank you.